Have you ever had a conversation with a Medicare for All detractor trying to convince them that it's the best way to go with health insurance in this country? I have too. And the funny thing is, when you get into the nuts and bolts of these conversations, you find that they actually agree with you in most, if not all, respects. And it's when you start throwing in words, and words are really important here because there are certain terms in the country that Americans have been brought up to view as evil and deadly or threatening. Terms like socialism, like communism, like Marxism, you know what I'm saying? So if you somehow relate some words in our language, in our culture, that are synonymous with these boogie words as pushed forward by the business community, by the media, and establishment politicians, you find that it's very easy to convince voters to go against their best interest. Okay? You put Medicare for All out there, at a fundamental level, Americans generally agree with this. But when you throw the words Medicare, that's linked in many voters' minds to socialism, which has been ingrained into many Americans' heads to be a boogie word. You know, the Iron Curtain and conformity and dead bodies and starvation and gray doom and gloom nonsense. Okay? So whenever they hear the term Medicare and they think socialism, they just automatically go against it because they've been trained to. Well, this is why it's really important, I feel, to really reframe, yes, that's the word, reframe the term. So instead of using Medicare for All, what do? I like to use universal health insurance. Take that in for a second. Universal health insurance. Why do I think this is better? I think this is better because that is exactly what Medicare for All is. It's more specific. It's, encompassing basically everything that Medicare for All is originally about, but it's rephrasing it in a way that is less threatening, okay? Because you're not using terms that are related to a single boogie word or a single person that is a little divisive among voters like Bernie Sanders. Even though he is the most liked politician in America, he's also an incredibly dividing, not divisive by his rhetoric necessarily, but by what the propagandists from the opposition have pushed about him over the years, have made him a more divisive character as a result of that. So part of what we do here is we need to rephrase how we push this agenda. And I think universal health insurance is much more accurate, it's much more specific, it's far less threatening, and it's a way to stop these opposition people from trying to do gotchas with boogie words, okay? Universal health insurance. Now, universal may be the only word here that poses a threat or an opportunity for the opposition to throw a boogie word in. Because when you say universal, some people like, I don't know, Ben Shapiro or Charlie Kirk or Tucker Carlson or whoever may come out here and try to say, universal, they want them illegal immigrants coming in here and taking all your, whatever it is, okay? Taking all your benefits. Well, that's an easy one for right-wingers to kind of go to and say, oh yeah, I'm going to vote against that because I don't like them there immigrants. Well, look, these same people in many ways agree with us on the policies of universal health insurance. So you can actually phrase it in a way using, I don't know, American Health Insurance Program. That's one way you could say it. But universal health insurance is a way of saying, okay, it encompasses everybody. It makes sure everybody has health care. And the way you can frame it in a way for right-wingers to be more supportive of is universal health insurance basically means we would have health insurance as Americans right out of the gate. From birth until death, companies no longer have to fish around for private insurance plans, so that boosts their stock portfolio and increases your take-home pay and wages, which addresses that issue alone without even raising the minimum wage, which is what universal health insurance would ultimately do. So if you want to win people over in this regard and get them onto your side with this issue, one of the best tactics to do is to rephrase the term. Okay? Take it away from things that have been solidified in our culture to be divisive. Medicare for All is good. It's supported by 70% of Americans. But I'm willing to bet if you changed it to universal health insurance or even American health insurance, watch how quickly those numbers jump. Watch how quickly. If you phrase it in an American first way, Watch how quickly the right jumps on board with it, at least a good chunk of them. Because ultimately we're human beings, we're all working class, most of us. We need health to survive, we need insurance to cover the costs of healthcare, we all know that. But leaving it up to private insurers leads to price gouging. It leads to basically these insurance companies being terrorists in a way, economic terrorists, because they effectively hold the economic gun to your head, giving you the same ultimatum as a carjacker, your money or your life. The difference is if a carjacker wants your car and you don't give it to him, blow your brains out, boom, it's done, right? But health insurance doing it, it's like, okay, pay up or you don't get health care, or if you do, you get stuck with a bill you'll never be able to get paid, you'll never be able to pay off. And basically people are subjected to a slow, agonizing, painful death through a bankruptcy, crippling debt, starvation, maybe homelessness, if it gets that far. So it's even more cruel and inhumane in this respect. And that's why I say private insurance is basically a crime against humanity at this point. Our own healthcare system is really a crime against humanity. Universal health insurance or American health insurance, if you term it like that, you're more specific about what it really is, and you're not lying. You're absolutely telling the truth about it. That's all Medicare for All is. It's universal health insurance. And it's very, very, very specific. Insurance, that is what it is. Nothing else involved. The government doesn't dictate to the doctors how to treat patients or who they can treat. The government doesn't tell the doctors which treatments they can use. It's just insurance. That's it. The doctors do their thing, patients get the care, they bill the government, and our tax dollars are used to pay the bills. That's it. That's all it is. And so I honestly think that on top of that, I have this thing about using a ranked choice voting system for the common good in society, which is in the Priorities Amendment. I believe I made a video about that. So that's a whole other discussion for those who want to hear more about it. Or you can go back and check the video. If you have questions, please leave them in the comments. But rephrasing Medicare for All to universal health insurance or American health insurance is, I believe, critical to moving this agenda forward in a productive and expedient way. Because you got to really know how to separate some of these boogie terms that Americans have been conditioned to view as negative. Okay? Health insurance, everybody knows it's non-threatening, it's neutral. Universal means everybody gets it. Or American health insurance if you're on the right and you want to be patriotic about it. Either way, you're telling the truth. And it's very specific. It's not leaving anything open for interpretation. And that's important to get the message home. That's exactly what it is. It's just insurance. Universal health insurance. Rephrase it, let's use it, and watch the victories pile up.